Dr. Lurie, thank you so much for joining me today.
It's great to see you again, Dr. Sharfstein.
So I'm going to make a prediction. We're going to start hearing a lot of people talking about how we need to be better prepared for the next pandemic, better tests, quicker vaccines. But we're not going to hear so many people talking about the core capabilities that make the difference for whether we can use interventions like testing and vaccines effectively.
Well, you're right. We do need better tests and we do need to have vaccines faster. But what we really need to do is be doing the day-to-day work of public health every day and to do it better so that when we need to pivot and use it in a crisis, we've got all those skills there.
So how do we do that? We have people listening who are doing all kinds of public health work, and they probably had to cut back on that work for the pandemic. And they may be looking ahead to just the immense challenges it could be in overdose or violence or food insecurity. And they're thinking like, well, anyone care about these issues, or is everyone just going to be talking about the next pandemic?
Well, I would maintain that the core skills to do all those things are the very same skills you need to manage a pandemic or any other emergency. So let's start with incident management or incident command, which we turn on whenever there's a crisis. But indeed, health departments that have used incident command systems for the last 10 or 20 years for outbreak investigation, for opioid overdoses, for food insecurity, for dealing with diabetes in their community, have found that the work goes better, faster, it's more efficient, and they get better outcomes.
So are you saying, for example, if you had like a spike in overdoses, the health department might say, we're switching to incident command, we're going to treat this like an emergency, and that's going to include how we communicate with the public, how we organize our services. And in a way, you're building the strength to respond to the next pandemic whenever it comes.
That's very well said. That's exactly what we need to do. And it's going to start with moving to shared situational awareness, as we call it, being sure everybody's seeing the same data. Most health departments now in a crisis put that stuff on a map. We ought to do that for everything. So you can see where it is, you see where you need to communicate with the public. You can figure out what languages the areas affected need communication in, just as an example. And you're right, we organize ourselves the way we organize ourselves for incident command, with a daily or a weekly incident action plan, with an incident commander, and with the elements of incident command that get you to that result.
So I hear you saying that doing that may actually make the response more efficient. I'm curious whether you think it also has an effect on people's understanding of public health, that to make that connection between the core capabilities of public health and the readiness for a crisis like a pandemic.
Well, one of the great things about using the incident command system, frankly, is that there's always a public information officer and there's communication with the public that doesn't happen lots of times in day-to-day public health, and really fine-tuning that skill so that the public health department is in the public health's consciousness every day or week, explaining what we know, what we don't know, what we're going to do about it, what the outcomes are. Those are the things that are going to make the difference in the eyes of the public. And if we see them making a difference for the things the public sees every day, like overdoses, like bad birth outcomes, like food insecurity, like a heat crisis, those are things that are going to make the difference in gaining the public's trust of a health department.
So in a way, what you're saying is public health shouldn't be afraid of the conversation about the next pandemic, but should be saying, hey, if you want to get ready for the next pandemic, let's take care of some of these problems like the emergencies and the crises they really are.
I would say we should celebrate the opportunity to be ready for the next pandemic. And we should let people know that they're going to get a dual return on investment for the resources they put into public health. And we need to show them the benefits of that investment day to day in everything that public health does. I think what we should be afraid of is the old mentality that public health is working best when it's not seen.
Public health has to be visible.
Every day.
Dr. Lurie, thank you so much for joining us at the Bloomberg American Health Summit.
It was a pleasure.